But what I am finding increasingly is that when I go into spaces, particularly healthcare, I'm having to educate some clinicians, some practice nurses about aging and HIV, and to recognize that being on medication for 20 something years, living with a virus for 35 years has taken its toll on me.
What I would say to clinicians is the best thing they can do is listen to the patient, because they will have experiences that the clinicians may have learnt about or seen similar things in others, but every patient is separate. And there may be something else that links their original condition. And by listening to them, you can then figure out various things that may be one of the answers.
As we age, we bring a lot of life experience and a lot of knowledge from different areas of our lives. So to speak to patients, to understand what skills and tools that they have developed to manage their condition over their journey, and that may be a very long journey like mine, or it may be they're recently diagnosed and they can dip into other areas of their lives. And the third and final thing that I would say for clinicians is to try to link patients who may be isolated with peer support, with other people who are living with HIV.
The biggest thing they could just start doing, see the patients and start getting involved in their treatment and pushing it forward, just as you would, as a GP would, for anyone who came with any issues, whether they were physical or mental issues. They'd help them, wouldn't they?
What I've done is to educate not necessarily my HIV providers, but general practitioners about the intersection of aging and HIV. And I think I've done that through just simply trying to make sure that they're aware that I'm positive, I live with HIV, and this may be having an impact. So I want them to make sure they're looking at absolutely everything and they're taking my HIV into account, whether that's the physical impact or the emotional impact of living with the virus.